Giving me an up-close and personal view. Hello, everyone, and welcome to the JoAnne Powell Show. I'm JoAnne. We're coming to you from the World Center of Broadcast Media, WCOBM.TV, Hollywood. We started the conversation in our last segment. We're going to continue it dealing with health care reform. It is something that Congress has been working on for a while. Senate Majority Leader Mitch McConnell had hoped to have had a bill passed before they went on their 4th of July break, but they didn't have enough votes to pass it. They're working on another bill, and they're hoping to get that pushed through Congress. You've got a lot of people across the country that are outraged over what they know about the contents of the last bill that they did kind of in secrecy. No one knew about it till it came out, finding that more than 20 million people were going to lose their health insurance, and that there was a big tax break for the wealthy in that bill. So there's a lot about the bill that a lot of people are not happy with. So there's a lot of work that has to be done. Kind of sorting through all this, joining me now is Minda Wilson. She is a healthcare reform expert, also the author of the book Urgent Care: 10 Cures for America's Ailing Healthcare System. Welcome back to the show.
Thank you so much for having me. I'm really excited to be here.
Well, the last time we were talking, we didn't know what the bill was going to have in it, so now we have an idea, and it's going to change, I'm sure, between what we know now and then when it actually goes on the floor. So what is your reaction to the bill that is out there now and some of the ideas that are being tossed around?
Well, the problem with the bill that's out there now is that there's nothing in it that addresses affordability. It's all about, tax breaks for the rich, as you pointed out, but it's also all about cutting federal support to the states for programs that they've mandated. So it means that people will get less benefits from state programs like Medicaid, Medicare, and that's a big problem.
It is a huge problem. That has people, protesting in front of the members of Congress in Washington as well as their home offices. You've got mothers of children that need this care that are out there, terrified. What is this going to mean to their child's health care? Or people that are in nursing homes. That's something that is a key component to keeping our loved ones that are, in nursing homes. And so it's just really kind of hit to the core of the American people.
Well, the good news, I think, that people need to know is if you're pregnant, if you have children, there's a separate law called CHIPS that governs those people's health care. And that will not be affected by any repeal, replace, change of Obamacare or any new legislation that's passed by Congress. Okay. That's a separate thing, and you will not lose your benefits. So if you have children that need to be covered, they're covered under CHIPS, and they will get the same care treatment that they do now. Okay. So that's the good news.
That is the good news. But if you are a person who's in a nursing home that needs the care, that's a whole different issue.
Yes. So if you're an elderly person and you're on Medicare, you're going to see your benefits cut. But that's been happening all along anyway. So whether or not this bill is passed or not passed, there has been a consistent and ongoing effort to reduce benefits provided under Medicare. And that's why you see all the new parts. Like when my dad was first went on Medicare, there was Part A and Part B.
Right.
Now there's Part C and D and, and F. And
yeah, you have to really do your research to know what plan you want to have.
And all those additional parts means benefits that the federal government used to pay for that now you have to buy insurance to cover.
Okay. Okay, that's interesting to know what it is, because you do see that advertised on television, like it's time to sign up for your plan. Which plan do you want?
Yeah, exactly. So you're actually paying for that through an insurance company that offers Medicare benefits, and the government is not.
Now, there are a lot of people that look to other countries. So you have Canada, you have Great Britain, Sweden, that have universal health care plans. What are the pros and cons to something like that? Because people are like, well, can we pattern or model ourselves after one of those countries?
Well, the thing about universal health care plans is that they work when you have homogeneous care. So you mandate care for everyone, and people have to follow their care plans, and people only get certain limited selections about drugs, surgery options, various kinds of things. And then when you get those, you're good. But if you want to do something outside of those plans, then generally you lose your benefits. You don't get to come back on the plan. So in England, if you want to take certain drugs for cancer and they're not covered by the plan, if you decide to take them, you've opted out of your health care plan, and you don't get to opt back in. And the other thing is, certain things are mandated. So in a place like the United States, where you have certain people unsure about vaccinations for their kids. If you lived in England, you must vaccinate your kids for them to be covered, for you and them to be covered under universal health care. If you decide not to vaccinate your kids, that's your decision, but then you've opted out of the system. So you're going to have to get a private plan to cover you and your children.
Because you were saying before that it's all about choices. We're used to, in the United States, to having choices. I mean, you do have choices of your health care insurance, whether you want to be an HMO, a PPO, so you have a lot of choices in doctors. I mean, there are some restrictions to your medical plan, but you do have choices.
Yes, and the truth is, in England, you have choices, but you have to pay for your choices. You have to suffer the consequences. So in the United States, for example, if you reach a certain level of obesity, you can continue to gain weight without impunity. The medical system will still take care of you. Your insurance will still take care of you. You're on Medicaid, Medicare. If you're 500 pounds, 600 pounds, you're still entitled to health care. In other systems, when you reach a certain level of obesity, I don't know what the exact number is, but let's say it's 300 pounds. If you continue to gain weight, then you're violating the terms of your coverage, and you're not complying with the health care regimen that you're supposed to comply with, and therefore the government becomes not responsible for you. So you can't get to 600 pounds and be in bed. You have to take care of it sooner.
So it's kind of like a proactive approach to the health care down the road of what they might be facing.
Right. So in addition, it's like saying, okay, you have a choice. You can either be cared for at your current situation and do these things. You have to comply. If you don't comply, if you don't follow the guidelines given to you, then you have to take care of yourself. If you don't take care of yourself, then it's an indication that you're not really interested in compliance, and if you're not interested in compliance, then we aren't going to pay for your coverage. So, it's pay or play.
And there's also, when you look at what's going on in Congress, there are some who want to repeal and replace, and then there are also those who are talking about just repealing and replace later because we said we're going to repeal. What are some of the concerns from your perspective on that?
So repealing it really takes us back to the system we had before we had Obamacare, which in a way was a more robust system except for people that had pre-existing conditions. But even they were not left out of the system. Every state in the country prior to the enactment of Obamacare had a plan that people with pre-existing conditions could opt for. It wasn't free, but even today, under Obamacare, those plans for people with pre-existing conditions are not free. You still have to pay for them. The difference is that then you had to pay full price, and now you get a subsidy if you're not earning very much money. So if you were on Medicaid, you still got free care under both situations. You were entitled to it before, you were entitled to it now. Medicare also, you were entitled to Medicare before, you're entitled to Medicare now. The real difference from from my perspective is that a lot of the protections that were there for people prior to the enactment of Obamacare have been dismantled because the insurance companies were going to provide them. And relying on the insurance companies isn't always a very good idea.
Well, there's one thing that's kind of interesting is that I think the key is maybe for both sides to kind of put politics aside and come together and work to come up with a plan that's best for the American people and take their time to come up with something significant versus trying to rush through something.
I just don't think they care that much about the American people, because the solution to all of this is really very straightforward. It's not that complicated, and it's not that expensive. So what they really need to do is say, for catastrophic care, if you get cancer, if you get diabetes, if you have some kind of ongoing health problem, if you have AIDS, then we'll provide. All insurance companies must provide a catastrophic policy. And then for everything else, that's up to you. And we'll have health savings accounts, which are tax-free money that you can put aside, your employers can put aside for your health care. And if you don't earn enough money to qualify for to pay for a catastrophic policy or put money aside for a health plan, there's always Medicaid. That doesn't go away. So we have the safety net. We have affordable insurance. A catastrophic plan before Obamacare was less than $100 a month. And even now, under these Christian gifting programs, which cover catastrophic coverage, with a $500 deductible, the cost for an insurance plan per person is only $175 a month, which is amazingly less than an insurance policy, which for the same coverage costs you $8,000 a year.
Well, I would like to continue this conversation, but unfortunately we've run out of time. Thank you again for joining us on the show. We'll continue the conversation at another time. We will be right back, and I'm going to tell you a little bit about what I did on my trip to London and the UK, so you don't want to miss that. You're watching the JoAnne Powell Show.
If you are an adult that began college and has not finished your college degree, let me put it to you straight. If your lifestyle and your standard of living is not becoming to you, then you should be coming to us, Oakwood University Elite Program. We are the fast, flexible adult degree completion program for the busy adult, like you.
Register today. Go to oakwoodleap.com or call 256-726-7098. It's time to leap.
I'm JoAnne with the JoAnne Powell Show. You're watching the World Center of Broadcast Media, WCOBM Hollywood.
Thanks to Oakwood University and the LEAP program, I have now a college degree. So to the Spanish-speaking members of this community who feel that the LEAP program is something you should consider, I would say, ánimo a la universidad. Considere el programa LEAP de Oakwood University.
Go to oakwoodleap.com or call 256-726-7098.
Seize the Day Scuba for your best scuba experience above and below the sea. You'll find friendly staff, experienced PADI certified instructors, and state-of-the-art scuba equipment and gear. Join our dive club and we'll help you plan memorable scuba excursions. Immerse yourself. Seize the Day Scuba, serving Southern California. Call 949-220-0500 to create your scuba experience.
When I first started into the program, yes, I had doubts. I was really impressed with Oakwood University, with the faculty and the staff, and the student body. It was a really good experience, and I would definitely recommend it to anyone who was thinking about going back and finishing their degree.
Register today. Go to oakwoodleap.com or call 256-726-7098.